It's about giving power to providers to really influence the type of people we want in our organisations and to influence the way we train them and educate them so that they really come out as clinical professionals that will make a difference to patient care.
The important thing for us in commissioning is to make sure that we meet the outcomes of the population. So the key thing for me is making sure we've got providers from across all sectors, including private, voluntary sectors.
The new arrangements for education and training are really positive, give us an opportunity. One of my main concerns would be that the voice of community trusts and indeed mental health trusts are heard, and that there is a perception that the new arrangements may be acute dominated, and it would be really important that the voice of community trusts are heard loud and clear.
The key thing is very much around the talent within the workforce to ensure that we have the strategic expertise and also the workforce planning expertise, because one of the things as a commissioner is making sure that there's quality in the system.
I think one thing is for us as an organisation to be really clear about what our workforce development and workforce planning needs are, and I think then it's really important that we participate in the process, engage in the new system, and just make sure that there's a loud voice for community healthcare issues.
It all depends on the mechanisms they deploy to make sure our voices are heard, because we can't make sure there's representation from everybody, every sector, every profession. So we've got to develop mechanisms to make sure that people can communicate through and communicate down and up.
We have to be positive about the system and move forward and acknowledge that, employers need to have influence over their workforce in order to deliver the outcomes that we require.
I'm going to go back to my organisation and talk about how we can ensure that our views are heard at the LETB. It's about having the right level of seniority that attends those meetings, that we participate in it, but also that our own views, our strategic plans are formed within our organisation, and that we ensure that that message is heard in the new arrangements.
I'm very optimistic as long as people listen. I think we've got to make sure our voices are heard and people have got to contribute to the development of the system. So yeah, quite optimistic.